Hello, this is Jeff Swenson again. We're here to continue our discussion on interscalene brachial plexus blocks. We'd like to point out some important anatomic features of the interscalene region. Specifically, we'd like to talk about the path of the phrenic nerve, also the transverse cervical artery, the ascending cervical artery, and some intramuscular elements of the brachial plexus found within the substance of the middle scalene muscle. If we look at this two-dimensional drawing, I'd like to point out the relationship between the phrenic nerve and the anterior scalene muscle. You can see that the phrenic nerve has been cut away superiorly, but it exits the interscalene space at about C6, crosses over the surface of the anterior scalene muscle, and behind the subclavian artery into the root of the neck. This relationship is very important. In the past, the technique for interscalene block was to palpate the interscalene groove between the anterior and middle scalene muscles and insert our needle into this area. And doing this technique put the needle in the direct path of the phrenic nerve. So now most people have switched over to a transmiddle scalene approach to the brachial plexus, which keeps us safely away from the phrenic nerve. If we look at this cadaver dissection, we can see we're looking at the left side of the neck, and to orient everyone, we've got an inset picture there on the lower right. You can see the sternocleidomastoid muscle, the anterior scalene muscle, the middle scalene muscle, the brachial plexus, and the clavicle. The phrenic nerve, as we mentioned earlier, exits the interscalene space, and we can see that the brachial plexus is covered thinly by a confluence of the prevertebral and deep cervical fascia, which is sort of translucent here. We can see the phrenic nerve, though, exiting the interscalene space here at C6 and then traveling across the superficial border of the anterior scalene muscle and down into the root of the neck. We'll go live here for just a second, and you'll see I'll pick up the phrenic nerve with the pickups here. So it's very easy to see that. This is an actual ultrasound of the left side of the neck, and you can see the sternocleidomastoid muscle here, the anterior scalene muscle, the brachial plexus, and the middle scalene. If you look on the surface or the superficial surface of the anterior scalene muscle, you'll see a small hypoechoic dot. This is the phrenic nerve. What we're going to do when we go live with this ultrasound is we're going to move the transducer superiorly and inferiorly on the neck, and you will see how the position of the phrenic nerve changes as we go superiorly on the neck to the level of C6. The phrenic nerve will move to a position immediately superficial to the brachial plexus, and as we go inferiorly on the neck, it will move across the anterior border of the scalene muscle. So we'll go live here, and you will see the relative position of the phrenic nerve change. So here we are moving superiorly. You see the phrenic nerve gets closer to the interscalene groove, and as we move the transducer inferiorly on the neck, it crosses over the anterior border of the anterior scalene muscle. Once again, superiorly, and then moving inferiorly on the neck, we see it go across the anterior border of the scalene. The transverse cervical artery and the ascending cervical artery are two vessels that may be encountered in the interscalene space. If we look at a neck dissection again, this time we're looking at the right side of the neck, and you can see at the bottom of the screen we have the clavicle. To orient the viewer, we have a picture on the right side showing that we are imaging the right side of the neck. This is the middle scalene muscle. This is the anterior scalene muscle, brachial plexus, and we have the subclavian artery passing posterior to the anterior scalene muscle. So you can see the thyrocervical trunk on the right, and the branches have been cut away. The two vessels that we mentioned, the transverse cervical artery, can either be seen in long axis or short axis. It is almost always seen in long axis, and the unique thing about the transverse cervical artery is that it can be seen within the same compartment and oftentimes even bisecting the brachial plexus. The ascending cervical artery can be seen on short axis or long axis and is usually in a layer superficial to the scalene muscles. So here's an ultrasound. We have the middle scalene on the left, the anterior scalene on the right. The brachial plexus is transected by the transverse cervical artery. When we go live here, you will see that. So here is the color Doppler of the transverse cervical. It's a fairly large vessel that actually goes through the substance of the brachial plexus. Here's another view of a different transverse cervical artery, and this time we see the anterior scalene on the left, the middle scalene on the right. And we've already injected some local anesthetic, and the space between the middle scalene muscle and the brachial plexus that is hypoechoic and illustrated by the arrows is a space that's been expanded with local anesthetic, and you can see how close we were when we approached and put this catheter in to the transverse cervical artery, abbreviated TCA. So we're going to go live here and you'll see the artery, and also we will inject through the catheter, and you can see why it's so important to be able to use ultrasound so that you can stay away from these vessels and still safely place a catheter. So there's the injection of our catheter close to but safely away from the transverse cervical artery, which is pulsating inferiorly in this image. Now, this is a vein in the interscalene space, and as we go live here, you'll see this is sternocleidomastoid, this is anterior scalene, brachial plexus, middle scalene. Now, what might be mistaken for a trunk or a portion of the brachial plexus, this hypoechoic area here, is actually a vein. We always, when we are performing a block, if we have any question about one of the hypoechoic structures in the vicinity of the brachial plexus, we always press down firmly with the transducer to see if that structure compresses. If it compresses, it's either a vein or an artery, so it's a pretty sensitive test. So if we do that on this particular case, you can see when we press down on the transducer, the vessel collapses, and that alerts us to the fact that that's a vessel, not a nerve. So there can be many variations in the vasculature, both venous and arterial, in the interscalene region. This is a different vessel in the interscalene region. Here we have middle scalene on the left, anterior scalene on the right, brachial plexus in the center, and as we go live, you will see a long axis. Remember, I said the ascending cervical artery typically is seen in long axis or short axis and is usually superficial to the scalene muscle. So in fact, that's exactly what we see in this case. It's compressible and also is visible on color Doppler. Now the other structure, the most superior aspect of the brachial plexus, looks like it could be a vein but does not compress when we push it down. So this is an example of an ascending cervical artery. This is a very unique structure. If we look, we have the anterior scalene on the left, the brachial plexus in the center, and the middle scalene on the right. Very commonly, if we are careful and when we examine the middle scalene muscle, we can almost always see an oblique fascial plane, illustrated here by the two arrows on the right. That is a separate tissue plane within the middle scalene muscle and often contains either the dorsoscapular and or the long thoracic nerves. So this is just something to be aware of in light of the fact that these are motor nerves and the patient may not notice anything if you were to hit it with a needle. We note these nerves and these structures and stay away from them while we're performing a block if the approach is through the middle scalene muscle. So as we go live here, you can see as we move the transducer superiorly and inferiorly the movement of these nerves within the middle scalene muscle. It's fairly common if you look for it.